Hello and welcome to this tutorial, which is the tutorial on the management of bipolar affective disorder. So you've seen the young gentleman and you're now going to see his mother. So the instruction to the candidate is you're about to see the mother of Neuro Brent, who you saw earlier, who was brought in by the police. His mother's concerned about him and she wants to know more about his diagnosis and management. So the instruction and task to the candidate is to explain to her more about his diagnosis and how you're going to manage it. Candidates, a key mental checklist and the bullet points which I would like you to jot down are the following 4 points to structure this station. You want to explain to her what the diagnosis of bipolar affective disorder means. You want to explain more about what the symptoms and signs are for someone with bipolar affective disorder. You then want to go to point 3, which is to explain the management in terms of the holistic or the biopsychosocial approach. And fourthly, you want to emphasize the need for compliance with medication. We will go through each of these step by step in the next few minutes. So the communication skills which are required in this station is that this is a information giving station, and also in a sense you're dealing with a concerned and distressed relative. In the information giving stations, and what I've mentioned in other videos, it is important to not get carried away with overloading the person with a lot of details. So in order to ensure that you do not do this, there are 2 key essential skills. One is to make it a two-way conversation, and 2 is to give bite-sized chunks of information. By making it a two-way conversation, you're ensuring that you're also addressing the other person's views, expectations and concerns, and shows that you are also listening to them. Because a lot of the time in the information giving station, we tend to get carried away by giving a lot of information, not realizing that that person might also have some concerns and questions of their own. And it's about tailoring the answers according to what their expectations are. And as you know, the college always puts down in the task is address the views, concerns and expectations, and it's because of this that you need to bear this in mind. The other point was to give bite-sized chunks of information. If you give bite-sized chunks of information, you're allowing the person to have some time to assimilate the information that you're giving them and ensuring that they've understood you. Another way to facilitate this is also to check periodically their understanding. So you could say in between is, have you understood me so far? Is there anything you would like me to clarify? And this is a good way of facilitating the interview and to ensure that you are not overloading the person with a lot of information. The information giving stations are easy to do, and you can get a clear path if you are able to use these two skills which I've mentioned. So now we get on to the suggested approach. So the initial approach would be something like this. Hello Mrs. Brent, I'm Dr. Mudlia, I'm one of the psychiatrists and I've seen your son, Nero. I've come to talk to you more about his diagnosis and management, but before that, may I ask you how he's been recently and whether you had any concerns. So using this approach is good because you're addressing her concerns because you know she's concerned about her son, and also you're going to be able to gauge how much of her son's illness she is aware of or she wasn't aware of. So once you've established that, you would then proceed to explain a bit about the diagnosis, which would give us bullet point 1, is you want to explain what bipolar affective disorder is. So you could start by saying that, Mrs. Brent, we've diagnosed your son with bipolar affective disorder. Is it something that you've heard of? So by asking her this open question is also, again, you gauging what her level of understanding is, and then you'll be able to tailor your information accordingly. Thereafter, you would proceed to explain about bipolar affective disorder. So you would explain, well, I would explain to you what bipolar affective disorder is. If you don't understand anything, please do feel free to interrupt me at any time. Bipolar affective disorder is a mental illness, and as the name suggests, there's two poles to the illness, where on the one pole a person can have high moods, which we call mania, and on the other pole they can have low moods, which are called depression. At present, your son has presented with symptoms of a mania. I would like to tell you more about that and what are the possible causes for bipolar affective disorder. Is that all right with you? So asking her and checking periodically is important, because you can imagine she's probably anxious and concerned and worried about her son now having been diagnosed with bipolar affective disorder, and there could also be some possible guilt feelings around it. So in terms of the etiological factors, if she asks you what are the possible causes, or you could volunteer, you could say something like this. Unfortunately, there's no one specific cause for bipolar affective disorder, and it is due to several factors working together. We do know that there is a genetic component, meaning it can be hereditary and be passed down in families. So there's a chance that if there's someone in the family that has bipolar affective disorder, there's a 50-50 chance of having this disorder. We also know it can be caused sometimes by stress and also due to a lack of sleep or disturbance in the sleep-wake cycle. Bipolar affective disorder occurs in about 5 to 100 people, and equally amongst males and females. It usually starts before the age of 30, however, it can occur later. This is the information available, however, you would need to tailor the information according to what she wants to know more about. Thereafter, you would want to proceed to talking about what the symptoms and signs are. The symptoms of bipolar affective disorder, as I've mentioned earlier, is that a person can present with symptoms of mania or depression. When a person has mania, they usually are extremely happy, full of energy, get easily annoyed, have a lack of sleep, and they become talkative. Their thinking also becomes quite fast, and they usually become impulsive, where they tend to spend a lot of money and take some risk-taking behaviors. Sometimes they can become psychotic, where they start believing that they have some special powers and beliefs. Are you following me so far? So your son Nero has presented with symptoms of a mania. Once you've given her information about bipolar affective disorder, what it means, what are the causes and the incidents and symptoms and signs, you could then move on to the third bullet point, which is the management of bipolar affective disorder. Mrs. Brandt, I would like to tell you a bit more about how we're going to be treating Nero. The treatment usually involves a holistic or biopsychosocial approach, meaning we have medication available, we have psychological treatments, and the social aspects of treatments. Is there any specific treatment you would like to know about, or can I start talking to you about the medication? The medication that is available is medication which we called mood stabilizers. To mention the names is, we have lithium is a known mood stabilizer, but we also have the medication which is used for epilepsy, the anticonvulsants like carbamazepine and sodium valproate, which we also use as mood stabilizers. I can tell you a bit more about them and give you some leaflets on this medication. Apart from medication, as I've mentioned, we have the psychological aspects of treatment, and this would involve a combination of some education about what bipolar affective disorder for him and also for yourself and the family. The other aspect would be, once he's more settled and stable, we could look at some CBT, which is also found to be beneficial. In the meantime, we also do suggest that he keep a mood diary to monitor his moods, and this will also give an indication of when he's becoming unwell. The social aspects of treatment, as I've mentioned, would be that of providing you and your family support. I work in a multidisciplinary team, and in the team we have nurses, psychologists, social workers, occupational therapists and physios and other therapists, and they would also be able to provide some sort of support to you and to Nero. This we can discuss more in detail if you would like that. So once you've given her the management in terms of the biopsychosocial approach, you could then move to talk about what the possible prognosis is, which I'm sure she would like to know more about. So in terms of prognosis, your response would be that it's difficult to say how Nero will respond to treatment, and people respond differently to medication. We usually keep people on medication for up to 5 years. Some people do recover sooner than others, and we know that at least 16% of people, more especially with bipolar 2 type illness, do respond to medication and get better. So it's about using all the different treatments available and continuing to monitor and support Nero to ensure his recovery and well-being. This would then take us to the fourth bullet point of emphasizing the need for compliance. You would need to stress that usually someone with bipolar affective disorder would usually lack insight into their illness, and therefore you would need the family to continually to monitor him and also ensure that he is taking his medication to ensure that he remains well. Once you've given her all this information, you conclude by saying the following: thank you, Mrs. Brent, for talking to me. From what we've discussed, I've told you that Nero has been diagnosed with bipolar affective disorder, and I've told you more about his medication and how we're going to treat him. I have some leaflets which I'd like to give you, as I know this has been a lot of information, and there are some websites that you can have a look at to get some more information. I am happy to talk to you more in detail, because I do know it was a lot we spoke about today. Thank you. Do you have any other questions for me? So this in a nutshell, would conclude the station for the bipolar affective disorder. So to recap, it's an information giving station, and the key points 1 to 4 would be explaining more about the diagnosis of bipolar affective disorder. 2 would be talking about what the symptoms and signs of bipolar affective disorder is. 3 would be explaining the management in terms of the biopsychosocial approach. And 4 would be emphasizing the need for compliance. I hope this tutorial has been helpful. Thank you.